Hi, my name is Alyssa and I'm from the NDIS Transition Support Team here at ADEC. ADEC is a Victorian not-for-profit organisation that supports people with disabilities, their carers and family members from ethnic backgrounds. This video will help you understand how to access the NDIS, the National Disability Insurance Scheme. How to apply for the NDIS. There are two main ways to access the NDIS. If you receive disability supports through a defined program, you'll generally be considered to satisfy the disability requirements without further evidence required to access the NDIS, such as Individual Support Package, ISP, Disability Support Register, DSR, Supported Accommodation, Early Childhood Intervention Service, ECIS. But up until this transition is complete, you should continue to receive your current supports. Number 2. If you're not receiving any disability supports from your state or territory government, or the supports you receive are not a defined program, and the NDIS is available in your local area, then you'll need to register for the NDIS yourself. Follow these easy steps to start your NDIS registration process. An access request can be started over the phone by calling NDIA on 1800 800 110. If you need an interpreter, ask for one and tell them what language you speak so they can organise one for you. Once your access request has been made, the NDIA will send you a letter requesting any additional evidence they may need. If you choose to complete the access request over the phone, be ready to answer questions about your primary or main disability and your secondary or any other disabilities. You can also ask for an access request form to be sent to you and provide this information in writing if you prefer. NDIA will need evidence of your disability. This includes information on what your disability is, how long it will last, and its impact on your daily life in areas of communication, mobility, social interaction, personal care, and organising daily tasks and routines. This evidence may be provided by a health or education professional in the access request form or NDIS supporting evidence form. So ask your GP, therapist or specialist to complete the form. You can also submit assessments, supporting letters or reports. It's good to give the NDIA as much information as possible so they can see if you meet the NDIA's access requirements. Once the forms are complete and you have a copy of all supporting documents, send them to the NDIS via mail, email or drop to the local NDIS office. Response to the decision. The next step is to wait to hear back from the NDIS about their decision. They can contact you via telephone, email or post. 3 decisions can be made. Further information can be required. Access met, which means yes, you have been accepted onto the NDIS. Access not met, which means you haven't been accepted onto the NDIS. Let's outline what these mean. Decision 1. Further information is required. The NDIS will send you a letter requesting further evidence in the forms of assessments or reports. If you have any other evidence which you didn't send with the access forms, now would be a good time to send these. You need to submit these additional documents within 28 days of receiving the letter from the NDIS. Try to do it as soon as possible. If you need more time to get these documents together, you can call or email the NDIS and ask to extend the time out to 3 months. After 6 months of no correspondence, the NDIS will close your file and you'll have to start the process again. Once NDIS have received your additional documents, it can take them around 21 days to process these and determine whether you've been accepted or rejected from the NDIS. Decision 2. Access met. If the decision is yes, you will receive a letter saying you've been accepted into the NDIS. Once you receive this letter, you'll need to wait for somebody from the NDIA or a local area partner to contact you to arrange a planning meeting. For more information about planning meetings, please watch our other video. Decision 3. Access not met. If your application doesn't meet the eligibility criteria, then the NDIA may reject your application. If the NDIS says no, please call them to discuss. They may ask you to provide more evidence, but they may also say that an internal review is required. For more information about NDIS reviews, please watch our other video. We hope this has helped you understand how to access the NDIS. If you want more information regarding NDIS, contact ADEC on 03 9480 7000 or email reception@adec.org.au.